question. It's always very important to be aware of the placebo effect, and especially as a researcher, to entertain the possibility that some of your effects are due to placebo. But first of all, the fact that a lot of what we know about certain disorders was discovered serendipitously, if anything, allows us to be less concerned about a placebo effect. If a doctor had given patients a certain medication that was meant for one thing, and it was observed that, hey, these patients who have a particular disorder were showing, in addition to the intended effects of a drug, alleviation of the symptoms of their disorder, you would not be particularly concerned that that's due to a placebo effect, because no one was expecting that. Placebo effect is when you start seeing the kinds of effects that you expect. But what was discovered about a number of these medications was that they were helping people with particular disorder completely by surprise. Now, once a medication is believed to play a role in a particular disorder, and clinical studies are being done to see if, in fact, it is significantly effective, at that point, there is generally going to be at least one group of people who are given a placebo, who are given an inactive medication. And when we look to see if a drug is effective in a particular disorder or with particular symptoms, we don't only compare it with people who get no drug at all, we compare it with people who are being given a placebo. And even if the people who are receiving the medication are showing improvement in symptoms, we look to see, okay, but are they showing significantly more improvement than the amount of improvement that we see with people with placebo? And this is standard. This is always looked at with any medication.